Meanwhile, South Africa has reported a spike in new COVID-19 infections. Experts say the resurgence could have been caused by a new subvariant of the Omicron strain. Almost 2,000 new cases were reported on Monday. More than half of those were in Gauteng. Some 30 deaths were also confirmed, bringing the total to 100,333 deaths since the pandemic started. Well, let's now speak to Dr. Aslam Dasoo, Co-Convener, Progressive Health Forum, joining us live via Zoom from Johannesburg in South Africa. Dr. Dasoo, thank you for joining us on the program. First off, so how much of a concern is this new spike in COVID-19 cases, and what exactly is driving it?
Good afternoon. It is, of course, of concern, but it has been expected. We were expecting to have a resurgence as the winter months approaches and, calling it the fifth wave, so to speak. And, all of these waves come with a great deal of distress, illness, and deaths, as we know. However, in this particular instance, we are not observing signs of any new variant. As you mentioned, it seems to be driven by a subvariant, a sublineage of the Omicron variant, which was responsible for our fourth wave. Now, there's two important things about this. That variant and that fourth wave was the first in which we saw a decoupling between the number of cases and the number of deaths when compared to previous waves. And the fact that this particular resurgence is being driven by subvariants of that indicates that it's probably not likely to be any worse than what we experienced during the fourth wave, and perhaps even less lethal. But that remains to be seen.
Well, the WHO is also saying that countries are beginning to slow down testing for COVID-19. And that, coupled with the removal of COVID-19 control measures in many countries, do you think there is cause for worry about a possible massive resurgence across the continent?
Yes, I think that concern exists, and I think it's well-founded. The Director General of the WHO is correct as far as that is concerned. I think it's also not surprising. This pandemic has been around now for over 2 years, and I think there is a bit of pandemic fatigue, not only among the people, but also among authorities. And the fact that we have learned a lot about the pandemic, we know exactly how it works, we know what works against it, and so on, probably has created a degree of complacency. The pandemic is still in full swing. This wave that we are about to experience in South Africa may indicate, and like I said, that remains to be seen, a trend where we may be pivoting out of the emergency phase of the pandemic sometime during 2022, if the predictions are correct. But until we know that for certain, I think we all have to behave as though we're still in the grip of the pandemic, get vaccinated, take the necessary measures that we're all fully aware of. And I think that is a very well-founded message as well.
All right.